more resilient future for all. And healthy societies are going to be, in prosperity. And in healthy societies, there is less chance that the conflicts are going to occur. And that's why I think that this is so strongly interconnected, that we have to give as much attention as possible to health and to the work of the World Health Organization. So thank you.
Thank you, President Musa, for that really powerful opening and introduction. And not to labor a point, but I think you've really touched on the heart of this. This is about health democracy. This is about ensuring that everybody has a role to play in society, and we create societies where people want to participate and can participate. And that leads to better health, better economies, better cohesion. So thank you for that. I'd like to now move on to our second distinguished guest and to introduce His Excellency Dr. William Samoei Ruto, the President of Kenya. Welcome. Great to have you with us today. We've got a very distinguished career. Previously, more than a decade as Deputy President of the Republic of Kenya, working in a number of portfolios in the government cabinet, and over a decade as a Member of Parliament. Your Excellency, can I ask you to share with us why social participation to drive equity and sustainable development is a priority for Kenya, and tell us about the journey so far?
Thank you very much. Your Excellencies, distinguished participants, ladies and gentlemen, on behalf of the government and people of Kenya, I want to affirm one basic fact, that health, as we say in Kenya, is not a privilege for those who can afford. It is a right for every citizen. Rights, however, matter not when they are proclaimed on paper or in theory, but when they are realized in practice. This is why Kenya places people, communities, and their voices in the very heart of health governance. Distinguished delegates, social participation is the bridge that connects policy to people. It ensures that communities not only benefit from health services, but also help shape the decisions that govern them. It is in this spirit that Kenya strongly supports the World Health Assembly resolution on social participation and social connection in 2025, which we view as vital instruments of transformational governance and inclusive development. When communities participate in health decisions, three things happen. First, policy becomes responsive to real needs rather than remote directives. Second, accountability and transparency flourish as citizens can follow and track how resources are used. And three, health systems grow stronger and more resilient, trusted by the very people they serve, especially the most vulnerable. In Kenya, this is how we ensure that expectant mothers has access to essential antenatal care, that every child receives life-saving vaccines, and that families are supported in confronting the rising burden of non-communicable diseases. Ladies and gentlemen, Kenya's commitment to social participation is firmly anchored in both law and policy. Our Constitution guarantees the right to the highest attainable standard of health on one hand, and the right of citizens to participate in governance. Both are constitutional imperatives. The Public Finance Management Act embeds citizen input in budget making, including in health, while in the Health Act outlines mechanisms for community engagement in service delivery. We're also aligning policy with action. We recently enacted 4 transformative laws to drive universal health coverage reforms. And why I say we had to change the whole architecture around law to be able to make health much more responsive. The old law had no place for people. The old law did not give voice to the vulnerable and to the people at the margins. And that is why we had to change the legal framework completely. Yet legislation alone is not sufficient. Participation must be practical and tangible. To this end, Kenya is pursuing 5 concrete strategies. First, we have empowered community health promoters with medicines, smartphones, and stipends, co-financed by both levels of government to ensure that last-mile delivery of essential services is done. We have 109,000 community health promoters around Kenya, and we facilitate them to visit every home. And this is to bring the insights and ideas of local communities into the health delivery equation. Number 2, participatory budgeting has been strengthened at both levels of government, supported by digital platforms to help communities track health resources transparently. Thirdly, Kenya is reinforcing primary health care networks so that communities can actively shape planning, implementation, and oversight. Today, every facility, every hospital facility in Kenya participates directly using what we are calling financial inclusion fund to make sure that they can decide the resources that are being used in every health facility and on what areas. Number 4, health literacy programs are being expanded to equip citizens with knowledge to make informed decisions and engage in meaningful governance. And finally, we are promoting multi-sectoral collaboration by linking health with education, agriculture, and social protection, thereby addressing the broader social determinants of health. Together, these strategies are strengthening trust, deepening accountability, and building a health system that truly serves ordinary people. Yet, despite this evident progress, challenges remain, chief among them sustainable funding or financing. The recent withdrawal of some external funds not only revealed diverse vulnerabilities, but also underscored a profound lesson. Ownership matters. When communities set priorities, monitor spending, and contribute through local mobilization and volunteerism, resilience is strengthened. I say this, that today we have enhanced local mobilization of resources for health. There was a time we depended on USAID and all the other good people. But today, our 300 billion shillings health budget is wholly 100% mobilized using domestic resources by Kenyans. It speaks to sustainability and predictability. Social participation is therefore not only a moral obligation, but also a financial strategy that reduces waste, increases efficiency, maximizes impact, and builds ownership. In Kenya, we are deliberately building a system that is less dependent on external aid and more firmly grounded in domestic solutions and community leadership. Ladies and gentlemen, as we look at 2025 World Summit on Social Development, Kenya affirms that health equity is inseparable from social justice and sustainable development. We call on this meeting to embed social participation indicators in global health frameworks and share knowledge and innovation that empowers communities to shape their health destinies. Another critical indicator that should be embedded in social participation is the commitment of resources not only to medicines and infrastructure, but also to the democratic right of people to participate in decisions that affect their health. Together, we must forge a renewed global social contract anchored in solidarity, participation, and equity, where every person, regardless of geography or status, has the right and the power to shape their health, their future, and their societies. Thank you very much. And I don't feel like Mr. Walt.
Thank you, Your Excellency, for putting very clearly on the table that social participation and equity are not just goals in themselves, but they bring wider benefits for trust, for cohesion, for ownership, and for being able to steer through difficult times when these come from externally as internally. And they're very, very important. So thank you very much for that. I would like now to turn to our final, but not least panelist on this session, which is Katrin Jakob-Bitterstor, who is currently the chair of the Pan-European Commission on Climate and Health for WHO, and formerly, as I know you, was the Prime Minister of Iceland and a champion for the WHO European Wellbeing Economy. Katrin, I know through your political career, transformation through participation, genuine dialogue has been at the heart of your portfolios as Minister of Education, Science and Culture, Minister for Gender Equality, and latterly as the Prime Minister. Can you tell us how, in your current role as Chair of the Commission, ensuring equity is at the centre of the work, and how is the Commission amidst the seeming backtracking of climate change, tackling this by engaging diverse voices? Katrin, over to you.
Well, thank you so much, and thank you, Natasha, for hosting us, and thank you, Natasha and William, for your very inspirational remarks, because it is important that we talk about health equity and social participation, not least in these very turbulent times. And I think Natasha said this very clearly when she described, the world we are living in right now. I entered the Icelandic Parliament in 2007, 2008. We had an economic crisis.
You're not that old.
I am so old. I'm not competing in this Miss Universe competition. So when I entered Parliament, there was an economic crisis just after that. 3 of our banks collapsed. It was quite a big bankruptcy. Then I became the Minister of Education, Culture and Research, having to do the budget cuts in very difficult times, really relying on genuine dialogue to kind of create that atmosphere that we cannot go through a crisis without social participation. And I think that actually, I learned a lot of lessons back then, and when the pandemic hit us in 2020, I could actually go to that toolbox, because I don't think, Iceland did very well through the pandemic when we look at number of deaths and how everything proceeded. And I think we relied on social participation then, but of course we also had the strengths of a public health system with equitable access, which is really